The strength of the UVM Infectious Disease Fellowship is a fairly unique environment in which the fellows are allowed to thrive. Specifically within the infectious disease division, I think we've made deliberate decisions that allow fellows to get the best out of their couple of years in fellowship.
The first year is primarily clinical, so fellows will spend 9 of the 12 months on the infectious disease inpatient service with 3 months of elective. And the second year is sort of the opposite. They have 3 months of clinical service and 9 months of research.
One of the strong benefits of being a small fellowship is that you have an enormous amount of clinical exposure. You're not necessarily competing with other individuals for learning and growth opportunities.
You see so many different types of infections. It really gives you an opportunity to figure out what you like about infectious disease, be it, chronic infections such as HIV, or more acute life-threatening infections that you see in the hospital. I think it just sort of lays the groundwork for all the different types of things you'll see in a career.
One of the unique things about Vermont is that despite the fact that it is somewhat homogenous from a racial ethnic perspective at the total population level, it's really incredible the kinds of patients that we encounter in the infectious disease world here in Burlington.
Patients on general medicine, patients on surgical services, but also you get to work with outpatients. I'm able to establish a long-term relationship with those patients and really get to know them and have continuity of care.
And you continue working with all subspecialties in medicine. We frequently see patients on an OBGYN service, a neurology service, a surgical service.
As someone who mostly oversees and tries to programmatically develop and enhance the HIV/AIDS program, I've been more than impressed with the kinds of patient encounters that we have an opportunity to engage in. New Americans, the refugee and new immigrant populations that undergo standard infectious disease screening for tuberculosis, for things like HIV. And so we have an opportunity to both do the testing as well as linkage into care.
Rounds in infectious disease, I'll say, are pretty much what you as the fellow, primarily the first year fellow, make them. All the attendings basically recognize that you should run the show, you should decide how you want to do rounds. Some rounding and teaching at the bedside, which I personally really like. It's not uncommon to go down to radiology and discuss the finding with a radiologist. And likewise, going down to the microbiology lab, I think that's more of a unique thing for us in ID versus some other specialty. We have this tremendous relationship that I think I take for granted.
The fellows aren't competing for attention with anyone. Here you have access to all the faculty. There's 1 fellow per year. If you wanted to, say, do a public health project with the state's Department of Health, we know them. They come to our conferences. You're not competing with 10 other fellows at 3 other hospitals. The milieu here is one in which a fellow can thrive pretty easily, I think.
Some of the opportunities we have both are for clinical care, which can be basic science. It can also be quality of medicine care and quality improvement. We also have opportunities to do some public health integrations and coordinations and collaborations with the Department of Health. And so a number of our fellows have taken out those opportunities, and it's been incredibly fruitful and rigorous.
We really try and tailor the research year to a really individualized approach that makes it interesting for the fellow, that they really take ownership of that project, and that they have a product at the end that they're proud of and they feel invested in.
Taking that time to get that kind of experience that you don't get in the hospital adds value in the sense that it makes you understand a lot about how the different laboratories that you order are done, how the information that you sort of consume as a clinician is generated. And certainly just that knowledge contributes to people becoming excellent clinicians.
When I decided to pursue a fellowship in infectious disease, I looked all over the country, and while there are so many great programs out there, ultimately I felt like staying at the University of Vermont Medical Center was the right fit for me for a few reasons, and I think predominantly it was the quality of the faculty here that really drew me in and kept me here.
And there's a lot of different personalities, different types of infectious disease doctors here, which I think is great too. You get passionate clinician educators, you get passionate bench researchers, epidemiologists, public health.
The fellows have easy access to all of us. We all have our offices in the same place. They have their own office. We all have an open door policy. Most of us are pretty much friends on outside of the hospital too. It's just a pretty easy relationship. We treat them more as junior faculty than we do as trainees.
We're very, very collaborative, and we frankly just have an incredibly good time when we're working together.
The interactions with the fellows, I think the thing that makes me smile most is watching them in their sort of trajectory over time. And you watch them blossom, if you will, a pretty quick period of time.
My fellowship was the best 2 years of my life. If you are watching this video and you're applying to ID fellowship, take heart. You're in a good place in your career. It's gonna be awesome. I'm excited that you're applying to ID. You've chosen wisely. My hope for you is that you get your first choice in the match, wherever that may be, but thanks a lot for checking out UVM.